So I wanted to make a video because the most recent experience I've had with healthcare, it just was kind of awakening, and I also spoke with a few other trans folks, and I just feel like there's not a lot of conversation around trans health and what trans people deserve, because I often feel like trans people are used to the bare minimum from healthcare providers and don't request more, which is what they deserve. And I had a recent experience. I went to this was kind of a while back, maybe almost a year ago now, that I went to my healthcare provider and asked her if she would prescribe testosterone. And because it's true that primary care providers are absolutely, it is within their scope of practice. It is absolutely within their scope. I think it's University of San Francisco has I don't even know, 100-something pages. And it goes trans feminine, trans masculine, what labs to get, how to prescribe, everything. Like, it's so basic. And it says NPs, PAs, and MDs are absolutely within their scope to prescribe. But they don't, because they don't want to. It's choice. And my primary care was telling me that she would not prescribe. I needed to see an endocrinologist in order to get testosterone. That is not true at all. That was her gatekeeping me. And up in upstate New York, there are very few providers that will willingly do this. Or willingly being like, they'll educate themselves. They'll take the time to educate themselves on how to do it. And so most of the trans folks up here drive. I've been driving an hour and a half to Planned Parenthood. But I also didn't really like my care there, and I'll get to that in a second. But I'm lucky enough that I actually work at the hospital, so I contacted the director of the LGBT Advocacy Committee, who actually sent me to this provider saying that she's like queer friendly, like she's done research, all this stuff. So I was expecting someone who knew how to speak to me, who knew like exactly what pronouns to use and what questions to ask and how to ask them. And that's not what I got at all. And I'm realizing that that's because the providers aren't held to any standard. So their standard that they give is like so basic, and they don't do any actual research on like how to speak to trans folks, non-binary folks, like how to even ask a question without being like disrespectful. And it's up to the trans community to correct them, but we're in a position where we kind of need to get from them what we need. So why would you cause any issues? Why would you anger your provider by saying, you know, you're saying that incorrectly, or that's really whatever, like hurtful to me, the way that you ask that question, or you know, the way you're speaking about my chest is dysphoric for me. Like, most people aren't going to speak up for themselves. It's a scary situation to be in because you need the care. So I went to this guy at the hospital and I was like, just so you know, like, she wanted me to go see the endocrinologist. I did try to see the endocrinologist. It was an 8-month wait to see him. So after about 4 months of waiting, I ended up going to Planned Parenthood. So I've been using them. In the meantime, this guy contacted the provider and said, like, you know, I just want to find out for, like, he didn't say it was me, but, like, I just want to find out for my, you know, other people, like, will you prescribe hormones to patients? And she said that it was the policy of the medical director that trans folks had to see an endocrinologist before she would take over their care. So he contacted the medical director, and the medical director said, no, it's up to each individual provider. So she lied to me, she lied to him, and it was basically because she didn't want to do it. And then recently, cut to now, I had my pre-op labs, and I had to get a pre-op physical for top surgery. And I went into the same primary care office, but a different provider. And I was speaking to her, and I realized she was actually, like, asking me the questions. Like, she knew what top surgery was. She asked about my testosterone. She knew how to ask the questions. It's super important on, like, how you ask the questions, because obviously people know that, like, if you ask it improperly, it can be really hurtful or just wrong. And then you have to turn into the educator role, which is not why you're at the appointment. You're not at the appointment to be the educator. You're there to be the patient. And I looked at her and I was just like, just out of curiosity, would you take over my testosterone? Like, would you prescribe it for me? And she was like, yeah, of course. And I'm thinking, I like looked at her and I was like, okay, because the other provider actually told me that I had to see an endocrinologist first. And she was like, no, a bunch of us do it. So in that moment, I was like, what the F? Like, I was sent and made to feel like a complete asshole. And then have been going an hour and a half to 2 hours to Planned Parenthood when they could have been doing it the entire time. So that just made me so upset, and I was like, no, obviously I won't go see the other provider anymore, just out of precedent. And this new provider emailed my other provider, and she was like, just so you know, she said that she would prescribe your tea for you. And I was like, okay, that's interesting, because she told me that she would only do it if I saw an endocrinologist. And she was like, no, she's saying she'll do it. And I just wanted to give her a big middle finger and just be like, you know what, you're doing that because you got caught. And screw you. So I'm not giving you my business. But I just really wanted to talk about this because I feel like providers are getting away with gatekeeping, and they're not being called out on their bullshit and being lazy. Like, it is not hard to do this. Yes, if I were a patient with a really extensive medical history and I had like a bunch of other stuff going on, maybe an endocrinologist would be a good idea. But I do know my history. There's not much to tell you. And I could have been started from the get-go. And one of the other reasons that I'm saying this is because I went to Planned Parenthood, and I've been really frustrated with Planned Parenthood because they never, so the only levels that they checked from the beginning were my hemoglobin, just my hemoglobin, which is one of the labs that they should be checking, but they should also be checking my lipid panel, and they weren't. And then they never checked my testosterone level. Never. I've been on testosterone for 7 months, and I switched my care over to my primary care, and just yesterday got my first testosterone levels checked at 7 months. That's not appropriate. So if you ever want to know, maybe I'll put the link in, but I think it's University of San Francisco has exactly what you should do as a provider for feminizing or masculinizing hormone therapy. It's typically 3, 6, 9, 12 months, and you would check, and it has a box, and it's really easy, and it's like what you should be checking each time. So Planned Parenthood basically said to me, because at 6 months, I called the provider, and I was like, last time we talked about this, we said that at 6 months, she never checked at 3, you were going to check my testosterone levels. And she said, all her response was, well, you're still getting your period, so I just like, they're probably low. What? No, no, it doesn't work that way. Yes, maybe my testosterone levels are low. Maybe not. But you can't, that's like one of the things that you look at when trying to decipher what's going on with someone. You don't just assume. Which is another reason why I tried to find another provider. Like, as a trans person, you have to fight for what you need. And I can't stress that enough. You deserve it, and you don't deserve to be treated like crap. And you don't deserve to keep going to a provider just because they're giving you what you need. Yes, you can do what I did. You keep going and getting what you need, because I know you need it for your mental health. I need it for my mental health, which is why I took the drive, 2 hours away, an hour and a half, to the Planned Parenthood, because the one here doesn't do it. So, but in the meantime, like, find that and fight for it, because you deserve it. I've talked to so many trans people, and I hear these stories about how providers are talking to them, and it just blows my mind. And the hard part, the really, really hard part, is being able to be in a situation and say, time out, this is not appropriate, this is not, like, what you're saying to me, how you're speaking to me is not appropriate, because you need care from them. Like, most trans folks probably don't even go to a healthcare provider. They have terrible experiences, so they just stop going, period, which is horrible. And it's just, I'm pretty sick of it. And my experience, I was just so blown away by the complete, like, disregard, and then to come back and to say, oh no, I'll take over your testosterone. And the new provider, the new provider said to me, oh, well, that might have been an old policy. Don't bullshit me. I'm not an idiot. Like, you've been doing it this whole time. She made the fucking choice. I'm sorry for my cursing, but I'm just really pissed. She made the choice to not do that for me. And a lot of trans people. Because a lot of trans people here are driving hours and may not have cars. Like, it's just, I don't know. It's astonishing to me that people won't just put, like, people who have gone to school for years to become a doctor won't do additional education for this community, because I know that there are a lot of trans people in this area who could really use a great provider who knows how to speak to people, who are, identify with different genders or sexual orientations or, God forbid, like, racial backgrounds. People don't know how to speak to them and just ask a question. How do you appropriately ask someone, if they're sexually active? Are you sexually active? Without just saying, like, oh, do you wear, like, how many times do people ask me, like, do you wear a condom? Well, no, but neither does my wife, so, and then they're just like, they get all awkward and they don't know what to do. It's part of their job to continue to educate themselves, and if you have a provider that won't do that, I just want to stress how much you deserve it. You don't deserve crappy healthcare providers. You deserve to find someone who's going to treat you properly. And, I will continue to look for that person. The woman I'm with now is fine. She's given me what I need. She's not, like, ideal, because she doesn't really, like, ask too many in-depth questions. Like, I went to her for my post-op for my top surgery, for my short-term disability, because I'm a nurse, I have a very physical job and won't be able to use lift anything over 10 pounds or lift my arms above my head for 8 weeks, and originally I only got 6 weeks. But I sat there and she didn't even want to see my chest. I have huge incisions, and part of this could be people assuming that because I'm a nurse I got it, I'm fine. And yeah, I would probably know if something was infected, but put your eyeballs on my chest. I don't even know if she's ever seen someone with top surgery. And that is possible because in upstate New York, it's trans folks either don't go to healthcare providers. There's another place called Trillium that has a terrible reputation, where they go all the way out to Planned Parenthood. The next closest provider that I actually almost went to get testosterone is 3 hours away. And I was willing to do that for a provider. When they called me, they asked me all the right questions. Their paperwork included and this is a general primary care practice in the middle of nowhere, upstate New York. And it's so basic to have that paperwork where you can check that box, or male, female, and you can fill in the blank, because it's not just other, it's not just trans, because transgender only that's an umbrella, and people fit within that. So do they know how to ask questions to narrow that down for that individual on what that means for them? People don't even know to ask, how many sexual partners do you have? Or, are they men, women, or both? People don't even know how to ask that question. And I just... it's infuriating to me. And I just want so badly for trans people to know that they deserve adequate health care. They don't deserve to be talked to like they're less than. And you're allowed to tell people tell providers that something that they're saying is inappropriate. And there are medical boards that you can report these people to, if they're not. I just, with this most recent experience, and I've had a lot of other experiences with providers, years and years ago, before any transitioning or even thinking about it, I've had short hair for a really long time, and I walked into a gynecologist office, and the woman was insistent that I didn't belong in that office. And she was like, "You're in the wrong office." I mean, I was 19 or 20. What? I don't know. It's just, you're allowed to ask for more, and don't settle for people who are just gonna roll over you because they can, because no one's telling them that they should be better, and they should be better. So that's my 2 cents about healthcare, and hopefully eventually I will go to NP school and be able to be this provider for people who knows how to speak to patients of all walks of life, cis, not cis, trans, whatever, anyone you want to be or who you are. I just want to be able to be that person, because there's not enough people out there that know how to work with the population. And I'm very passionate about it, and I've talked to too many trans folks who have had really awful, surprising, sad experiences with healthcare. And so when your bar is this low for healthcare providers, and you get something a little bit better, it seems like a gold mine, but you actually deserve up here. You deserve someone who knows how to speak to you and knows that they even know to ask what names for your body parts are going to make you most comfortable, because some person might be comfortable with chest and some people might be comfortable with like not naming anything, like, but that's individually. And the only people I've ever heard speak about that is when I went to a trans health conference in Boston, and it was people from Fenway Health. But that's what they do, and they're trained, and they have worked with so many different people. But there are absolutely providers out there. I went to this conference and there were hundreds of providers from all over the country, so they are out there. And I actually know someone in Maine. I know someone in Rhode Island. Maybe Boston. I do know some providers, but I would definitely recommend Fenway Health to anyone who's around that area. And if you happen to live in upstate New York, I could definitely help out and give you some names of some people that would be healthy providers to go to, so you can get what you need.